All right. It always starts. Did I ever tell you the time that I lectured at Nutritional Frontiers and the ceiling fell on me? The giant wasp tried to kill me. So it was a whole lecture. This is not going to work there. I don't want to do that. All right, we're just moving on. Okay. Nope. Can you put that up? Thank you. So just a brief introduction of who I am. I don't like lecturing from this side. So I'm the Chief Health and Growth Officer at a company called Get Healthy Store. Is anybody familiar with Get Healthy? Nikki. Yes. So imagine if Amazon and FullScript. This isn't me. I'm just going to hold this. Imagine if Amazon and FullScript came together. So full front shopping experience, full dispensary on the back. That's Get Healthy. So we provide you with an online store that has over 350 brands, including Nutritional Frontiers. They are our #1 product. They beat all other companies on our list by $500,000, I'll add. So they're doing very well through us. But we also provide you with 8 wellness categories, so more than supplements. So you get food, nutrition, personal care items, infrared saunas, water filters. Think about your clients and what you educate them on. And then they go to Amazon and they buy it because you gave them the wisdom to. This way they stay with you. No cost of goods sold to you. So the papers are on your tables. If you want a demonstration, it's free to come meet with one of our account managers, and they will provide you with a free demo of the technology, no obligation. But it's an actual person, so you can ask questions. We have integrated with learning management systems such as Thinkific. We've integrated with Avexia Diagnostics, so you can script your blood work, your solution, your course, all in one link, one place. So no more affiliate, no more all. I'm not doing anything, and this is cutting out. I just want you to know that I didn't touch it. So I'm also a naturopathic doctor. I've been in this industry about 25 years now. I should update my PowerPoint because I just try to stay young, but the years keep going, so it doesn't work. I also started out in personal training, so I have a degree in exercise and sports science. I'm a mom of 2 boys. They're 14 and 10. I started late, so it's fun having that last one at 40. That was great. And I'm also a wife and a lover of Jesus. So as Rhonda said, I'm not ashamed of my faith. So how many people do diagnostic tests in your practice? Blood work, any other type of testing? Okay. So blood work's been around forever. I think we realized that you have clients come in or they go into their doctor or their PCP, and the doctor says, well, your blood work's normal, everything's fine. Yet they don't feel fine. A lot of people get dismissed as maybe depressed, anxiety, it's all in your head. Well, one of the things that we have to realize is blood work is a compilation of about 1,000 people that they averaged out their numbers, and all those people were in the hospital, they were sick. So we're looking at numbers that are extremely broad. Let's take TSH, thyroid stimulating hormone, for example. TSH can be 0.45 to 4.5. I have people that are thyroid symptomatic at 1.6. I have people that are thyroid symptomatic at 2.7. And TSH is all they draw. Instead of looking at T3, RT3, TPO, thyroid antibodies, they're not looking at enough numbers. Even for thyroid, I have a smaller set of numbers that I look at, and I look at patterns between them. So it's not just about looking at the blood work, it's about looking at a more closer range, a functional range for that individual. And when they're in that functional range, that's when they can heal. We have too much left and right on the blood work. Too far numbers that are outside, and that's considered normal. It's kind of like a 4-lane highway. But if you stay in your own lane, you cause much less stress to the people around you and to yourself. Okay? So tonight we're going to learn the functional ranges, the ones that I tried to scale down a little bit. These are things that I've seen clinically, things that I've read that other practitioners who have done functional blood work in this space have put together. And so we're just going to go over the CBC with differential tonight. And we're going to learn the ranges. And when you leave here, you're going to look at blood work with a whole new set of eyes. And I will tell you that for about $75, you can find out more about your patients and clients than most of these $400, $500, and $600 tests. I know genetics is a big hot thing right now. We got AI technology basically taking your jobs. So the blood work stands. And this is a snapshot of what's been going on in your clients for a long time. So by just doing a simple CBC, a CMP, a cholesterol panel, right, your lipid panel, and your total serum iron, for about $75 that you can send somebody to LabCorp to get, or they themselves can get it. Because newsflash, a lot of people don't realize that you don't need a doctor to script you blood work. You can walk into a lab and order it yourself. And so that's super empowering for your people. Basically we run out of ourselves, right? We get limited by our time. There's only so many people that we can see. The reason I teach this, not only to doctors, but to lay people, is because we need to teach self-help. It's a really big part of what we do. We need to get people to be invested in investing in their health because we're way too reactionary. It's not a bad thing to have a blood draw every year or every 6 months. It's actually great, and it's affordable, and it's doable. So that's what we're going to talk about tonight. So you'll see all types of measurements on blood work. These are the components that I ask for. CBC with differential. Most of the time, doctors are not drawing the differential. The white blood cell count can be off, but the differential tells me what the immune system is shooting at, where the immune system attention is directed, and where I need to direct my attention, because that's going to be the biggest screaming child. The CMP, the lipid panel, and serum iron. So when we're talking about complete blood count, if you're not familiar with blood work, this is a look at 3 types of immune cells: white blood cells, red blood cells, and platelets. And the health of your red blood cells, your platelets, determine the health of your white blood cells. And here's another little news flash. Your immune system has 4 pathways of communication. It talks cell to cell. That's called paracrine. It talks to itself. It's called autocrine. It talks to your hormones. That's called endocrine. And it talks to your neurotransmitters, which are brain hormones. That's neurocrine. So 4 pathways for the immune system. So if you're looking at just white blood cell or red blood cell, or you're looking at just hormones, or you're looking at just neurotransmitters, it's kind of like the Godhead, right? If you're Christian, we believe Father, the Son, the Holy Spirit, 3 separate beings, 1 entity. That's your immune system. It is white blood cell, red blood cell, platelets, that's 1, hormones, and neurotransmitters. You cannot segregate them out. If you have hormone issues, you have an immune issue. If you have a neurotransmitter issue, you have hormone issues. They all talk to each other and they let each other know what's going on. So if you take anything out of this tonight, when we looked at COVID, when it hit, we had people that had brain issues. They lost sense of taste and smell. That's mast cell activation. Their hair fell out. That's mast cell activation. That's a different set of immune systems. Those are collagen immune cells. They also lost their hair, right? They had POTS. All of that is mast cell activation. But it manifested in the neurotransmitters and the hormones, not just the white and red blood cells. So we can't separate it. So when you're looking at a CBC, you're looking for patterns. So I'll teach you that tonight. And then that's going to give you what other tests, if you need them, to draw. So with the red blood cell count, white blood cell count, what I see, obviously, is overall well check of their immune system, but also I can see methylation issues in the CBC. I can see iron need in the CBC. I obviously can see viruses and bacteria, but you can also see fungus and parasites. So you don't have to run the GI map and this map and that map. And basically what happens is we financially strip these people so that they can't get the solutions they need. And so for a $75 test, you can find out 4 or 5 different pathways. If you can't figure it out from this, you can run 1 additional test and start with the biggest screaming child. And it's a better phased approach for your patients since they're paying out of pocket, because let's face it, insurance is a racket, right? They're paying $500, $700, $1,000 a month for the type of care that they don't want. And basically it's disease management protocol, right? They're just waiting to get sick so they can apply their insurance so that they can get a drug that's going to mask their symptoms. And we call that health care. So we have to change. Comprehensive metabolic panel. This is also known as your chemistry panel. Obviously, it's going to test your glucose levels, your fluid, your electrolyte balance, your kidney function. All of those systems talk to each other. It's really important that we look at the patterns between them. But I can also see if you have leaky gut in your comprehensive metabolic panel. I can see if your adrenals are taxed. I can also tell most of the time what kind of adrenal support you need to supply, whether it's a glandular versus an adaptogen. And you can also see amino acid need. Albumin is always the first place I go on the comprehensive metabolic, because that's going to tell me about a bigger disaster later. Mostly the big C word, and I'm not talking about COVID. All right, lipid panel. This is cholesterol. We're little cholesterol. You get such a bad rap. I hope everybody in here knows that there's no such thing as good and bad cholesterol, right? We're all aware of that. That we're going to remove those two words, good and bad, when it comes to cholesterol, right out of your mouth. Don't ever say them again. It's kind of like saying burning fat. Physiologically impossible. I'm going to spoil everyone's night, ladies and gentlemen. By the time you're 22, you have a set number of fat cells in your body. They get bigger or smaller depending on deficiencies and toxicity. Fat cells are part of your immune system. They release adipokines. Those are proteins that stimulate things like TNF-alpha, interleukin-6. So fat cells are super important. So when we're talking about cholesterol, it binds with a good fat to create different pathways of repair. Brain repair, hormones, and also the vascular integrity. Now when you think about how does it repair your vascular system and what all does that entail? It repairs the endothelial tissue of your vascular system. It's going to patch it. Where do you have endothelial tissue? Everywhere. Blood-brain barrier is made from endothelial tissue. Right? Your gut lining has endothelial tissue. So one of my little, as Len always calls it, clinical pearls, is if you can't get somebody's gut to heal, give them nitric oxide, because it's endothelial damage, and they can't pull the tight junctions together. L-glutamine is great, but it's only one part of it. You have zonulin activating, you have all kinds of things. So endothelial tissue is also part of the renal tissue. So when we look at all of the mechanisms of how cholesterol works to repair, why is our statin industry one of the largest prescribed medications in the world? Why are they trying to kill something that is so good for our bodies? And so in the course that I do on this, I break out what cholesterol is, what's HDL, what's LDL. Basically LDL's, those are the boats that are going to carry out your fat-soluble vitamins, your cholesterol, as well as your triglycerides. And then those triglycerides and all those nutrients get dumped into the blood, and your cells pick those up with their receptor sites. Usually, if your cells are swollen, inflamed, you're deficient, you don't have enough, your LDLs will stay in the blood. They're not going to go back to the liver. They haven't done their job yet. So we keep looking at how do we lower cholesterol? How do we lower cholesterol? You lower it by making the cells optimal to receive nutrients. That's lowering systemic inflammation. That's lowering the size of your fat cells. That's lowering the immune system modulation that's happening, right? Your immune system is flared. That's why the CBC is so important. That's why we have to look at it. Serum iron. A lot of people don't test this, especially on men, but you can see your first measurement of inflammation in ferritin. So high ferritin is going to tell you of systemic inflammation. It's not just about being anemic or not, it's about being inflamed or not. So your serum iron is going to give you a total iron. It's also going to give you your TIBC, which is your total iron binding capacity. That is going to go up if you're low in iron or you need iron. You can have high ferritin and all your other numbers be fine. You can have perfect iron stores and see it low in your CBC. And I'm going to show you what that means. So when I do a baseline, I do more than just a CBC and a CMP and a lipid panel. I do the serum iron, I do the differentials, I usually ask for a vitamin D panel, probably an A1C. I want to see what's happening. The cholesterol for me, and this is something that everyone should really pay attention to. As a woman, okay, and I am 50 years old. I'm 50. So I'm 50. I turned 50 this year. And I hadn't had any blood work done. But here's what's really normal with that. Your cholesterol should go up. If you are a middle-aged woman and your estrogen starts to go down, and cholesterol is responsible for the pathway that builds hormones, obviously cholesterol is going to try to increase to balance out that molecular pattern that's happening. Your body has to catch up. It's absolutely normal for cholesterol to go up. It's absolutely normal for cholesterol to increase if your body's trying to repair something. If you have leaky gut, if you have leaky vessels, if you have leaky brain, you get a head injury, measure your people's lipid panel once after a concussion. Your cholesterol will be spiked. It's trying to repair it. So we have to stop looking at cholesterol as the enemy. It's trying to tell you something. It's the first thing I'll look at for women. When they come in and I do their cholesterol panel and they have high triglycerides, I know they have estrogen issues. If they have high LDL and high total cholesterol, I know that we have other hormone issues. I may have to run a little bit of additional tests on them. I might have to get some panels on female hormones, even males. It's one of your first signs of hormone dysregulation. But if she's in menopause, it's normal. Don't focus so much on things. There are no correlations at all in the medical journals that tell you that lower cholesterol creates a lower incidence of cardiovascular disease. It doesn't. There's nothing that ever proved that data. They just said that, and everybody believed it. So now everyone's on a statin because somehow they think they're preventing cardiovascular disease. They're not. What they're doing is creating dementia. They're creating mass hormone issues. They're creating leaky gut. They're creating fatty liver. If they can get you on the statin, they're going to have 4 or 5 different pathways of disease they can medicate you for. It's why it's in the trifecta. When a person goes into the medical office and that doctor diagnoses them with high cholesterol, they're going to offer them the statin, a metformin, also a blood pressure drug. And they have to, in order to get the full reimbursement on that hour. They have to prescribe it. They don't have to take it, but they have to recommend it. So we have to know how the system works. They know what medications cause what. And so look at our elderly community, especially right now, when the whole statin industry hit. We're seeing more dementia now than ever. We're seeing more brain issues. I mean, they keep lowering the numbers of cholesterol. What are we at now? 120, I think is the new number. I mean, how low are we going to go? And if we all went to the same schools, we all read the same medical books, how do I know one way and they don't know the other? I mean, is it intentional? Do they just forget coming out what cholesterol does? Cholesterol sits at the top of your hormone cascade. Cholesterol and a good fat form pregnenolone. Pregnenolone goes 2 paths, DHEA or progesterone. So if someone has low progesterone, what's going to happen to cholesterol? Your body's going to produce more, so it can make more pregnenolone. If somebody has PCOS, going down and making too much DHEA into testosterone, what's going to happen? The body's going to make more because it's going to try to make progesterone. The body never does anything wrong. It responds to the environment that you put it in. Whether it's a stressful environment from food, from medication, from the SAD diet, standard American diet, it will respond physiologically. And what I tell people is be thankful, otherwise you'd be dead. If your body quits responding, that's called death. So we have to stop putting the disease label on people. I don't believe in disease. I believe those names were made up so you could put a code on an insurance form, you could prescribe a medication for it. Your body has as much physical discernment as it does spiritual discernment. It reacts. It doesn't like something, it gives you a sign. So in October, I'm teaching face, tongue, nail. I'm going to teach you to look at somebody and you can tell them what's wrong. That's super fun at parties because you can just walk up and be like, oh, God, your thyroid. Oh, you feeling all right? You okay? And they'll be like, what? What's wrong with my thyroid? Right? You should come see me. Yeah. Whew. Yeah, don't do that. I'm kidding. Don't do that. Maybe after like 3 glasses of wine, then you have an excuse, but not when you're sober. Don't do that when you're sober. So the body is amazing. It's not broken. We tell people that it's broken or it's doing something wrong. It's not. It's doing everything possible to save your life. So these are some resources. If you're not a licensed physician and you want to order labs, you absolutely can. Get hooked up with somebody like Avexia Diagnostics. That's a marketplace. And even if you are licensed, this gives you access to 2,200 diagnostic tests from blood serum draws. They link up with LabCorp all the way into specialty tests that can be sent at home, gut tests, diurnal cortisol. That's one of my favorite ones to do after a blood test. So if you're interested, you can go look those up. I know that. Go ahead.
Yeah, I was just going to say that
Want my
for
mic?
their clients, if you'd like.
Mhm.
All right. Nutritional Frontiers has a discount with Avexia for any labs that you might order. The discount code is really easy to remember. NF.
Very
Okay?
simple.
There you go.
So you can even pass that little NF code on to your clients and patients. So you go home, you sign up with Avexia, you start scripting blood work, you can give them that code. It'll get them money off. You know, in some states it's illegal to make money off testing, so you don't make money off this type of testing, but it's super beneficial to have as a resource for your patients and clients, especially for people that today, they don't want to go to the doctor, they don't want to go to the emergency room, they don't want to go in, they don't want to deal with all the questions, they want to come to you, and then you say, well, I need blood work, or now I want blood work. You have a way to do it. Okay, so I want everyone to get into their folder. Mine's really messy, but you have the full CBC with differential here. That are my notes. And what I did for you was I laid out the functional levels that I like versus the normal levels that you'll see on your tests. Does everybody have a copy of it? You guys didn't give me a copy of this here? Oh, poor Phil. He's getting blamed. He's just the tech guy. All right, listen. If you have a blank space, just take notes, and I'll make sure that you guys all get a copy of this. You want to go make copies? You can't have mine, because mine has all my stuff on it. So, that kind of just like popped my balloon. Are we going to get a copy of the presentation? Yes, you'll get a playback if you want it. I also did a webinar in this for NF, which you can get a copy of that. So, if you want to draw this out, you can, but we'll make sure that you get this. Okay, so at the top, and this is usually how it looks on your blood work, right? It starts at white blood cell count, then it goes to red blood cell, et cetera, et cetera. With that said, I'm going to come back to the white blood cell count and start right here with red blood cell count, okay? So red blood cells, they carry oxygen to tissues. That's their job. And what this measures is the volume of how many of these you have to potentially carry oxygen to your cells. For women, they need less than men, okay? Because men have more muscle mass, they're usually bigger in stature, they require more oxygen to do whatever they need. So all of these numbers are going to be different between males and females. Biologically, we are different. It's just the way that God made us, okay? So for females, the red blood cell count should be 3.9 to 4.5. Now, you might have a total serum iron on this client or patient, and it looks perfect. It's fine. It's in the normal ranges, because we love those words. However, you might notice that your patient is below 3.9. Well, what would that mean? Anything lower than this standard on the left, the low points, is iron need. I don't care what their serum iron says. What is happening is the serum iron, or the storage of iron, is not getting into the cells. It's not being utilized. And iron is in every cell in the body. It's your main conductor. You need it. And in the CBC with differential, this is the first place I'm going to look for iron need, even before I look at the total serum iron. I want to know, whatever they have in their savings account, are they getting it into their checking account so they can use it and spend it to buy more oxygen? So if it's below this, it's low iron. I remember how I said I can see methylation need. If you are high on blood cell count, and I'll go through what all these mean, your hemoglobin, your hematocrit, if you're high, that's methylation need. Does everyone know what methylation is? Okay, it's probably been beat to the ground by Dr. Ben Lynch, right? He and I did like a 4-hour presentation on it when I was here about 6 years ago. But methylation is your ability to make new and healthy cells by utilizing certain vitamins, B vitamins in the form of folate and methylcobalamin, B12. But it's also your ability to create enough glutathione, enough SAMe for neurotransmitter function, to be able to detoxify, to be able to think clearly. But methyl groups that are created from this process are also used to silence viruses, bacteria, and any type of oxygen robber in your system. So when you're a low methylator or a poor methylator, you have numbers higher than this 4.5, 4.9, 14.5, and you have parasites to boot, you are going to have a hard time detoxing and recovering from that cleanse. Okay, so when you're looking at the CBC, we're looking at foundational. What do I need to do in order to get my client to be able to recover, to be able to detoxify, to be able to heal the gut lining? You cannot heal until your blood's in a functional range. And that usually will happen once you get it there. You need 60 to 90 days to hold it there. So people will say, when do I have to get my blood work again? I'll say 90 days. Well, don't you want to see changes in the next month? No, I don't care about changes in the next month. I want you to do what I want you to do for the next 60 to 90 days. Yes, we can do care calls. Yes, you can come in, tell me about your symptoms and how great you feel. We can do that. But we're not going to run blood work for 60 to 90 days. Now, if you have somebody that's super sick and you want to keep a closer eye, totally fine. But I usually do 60 to 90 days. People can spend $75 every 60 to 90 days. They don't complain about it. I never get any pushback. They're happy to go because they really want to see these numbers change. Because when I lay this chart in front of them, and yes, I actually have this printed out. I call this my little dork binder because I'm a dork. I'm a geek. This has, no, you can't have it. This has all of my stuff in it, and it's all, I have a laminator too. Yeah, I'm that bad. So I laminate all these, and you can use a dry erase marker and write the numbers right in there from their blood work if you want. Lay it out in front of them and talk about what it all means for them. They actually really appreciate the education because it makes them feel validated that they're not crazy, that they knew they didn't feel good, but nobody ever told them something like this. It makes you look amazing as a practitioner because you are listening. And I will tell you, when you say to somebody like, I hear you, I see you, it is a form of compassion that they've never received. So hemoglobin, this is the protein that is contained within the red blood cell. So we're looking at how many red blood cells we are, how many proteins are available for synthesis within the red blood cell. The hematocrit is the proportion of how much is in the blood. And then MCV, MCH, mean corpus value, these are concentrations of hemoglobin, hematocrit, and relative to each other. So all of these kind of mean the same thing. If they're low, you need iron. If they're high, methylation issue. And a lot of people today have MTHFR, methyl-tetrahydrofolate reductase mutation. So we do have to look at this need, and you can fill this, as you can see, on the right-hand side. So I did put the Nutritional Frontiers support. What I want you guys to do is remember that DMG would cover this entire thing, dimethylglycine. How many people use dimethylglycine, DMG? Darn mighty good, right? From head to toe. I would say DMG falls apart, so you don't have to. So DMG is actually an amazing nutrient. It actually will break down, and as it breaks down, it'll throw a methyl group into a pole that your body can use regardless of genetic mutation. It sits there. Now you need amino acids in order to bind with that methyl group so that you can make DNA, RNA, your immune system. Also so you can make hormones and neurotransmitters. So having that albumin number on the CNP, remember how I said albumin's always the first number I look at there? You need the right amount of albumin to have the right amount of amino acids available. If your albumin's below 4.5, you're trending towards some sort of issue that's going to turn off P53 transcriber. Do you guys know what P53 is? Heavily reliant on amino acids. P53 is a transcriber that turns genes on to kill a cell that should die or repair it. So you should have no such thing as sick cells in the body. They should be either healthy or dead. You don't want something that's living and doesn't feel good. It's just going to make you sicker. So P53 will transcribe the genes to look at a cell and say, can I repair this? If it can't, it's going to create the apoptosis of that cell, the death of the cell. That's what you want. In all cancers, P53 is completely deactivated. So cells never die. So you need the right amount of amino acids, and there's more studies on dimethylglycine, which is amazing. Where's the book, Phil? Who has the book on their table, Building Wellness? thought she was going to say it's $500. I was like, dang, girl. Hey, you got a car payment due? What's up? Yeah, so that was Dr. Kendall, PhD. He has all of his clinical trials and studies in that book. It's not a cover-to-cover read, like super interesting, but it's really cool to read. His research on autism with 500 milligrams of DMG. He had like an 80% recovery rate on emotional and behavioral outbursts with autistic children. There's studies in there on skin cancer and dimethylglycine. It's amazing what it did. So it initially was banned in the United States up until about, I think it was the 1980s when they brought it back. It's what the Russian athletes used back in the 70s that got them disqualified from the Olympic Games. So it's good stuff, right? Someone had a question. Yeah.
So she was looking for vitamins without ever
Mm-hmm.
unmethylated. And also, I mean, I showed her the dimethylglycine, and she went to what's the difference between dimethyl and trimethyl.
Yeah, so those two questions, I'll repeat them. He said he had a client that came in and claimed that anything methylated made her sick. I'd probably say she's a heterozygous compound, 1298C, 677C, MTHFR mutation, guaranteed. They're super sensitive. And so you want to go to more of a bioavailable level than a methylated. So one up from methylated. Little bit less methylated. If you use DMG, you can just use it slow and give her some. And what's going to happen is like it's a parabola with the 1298Cs, with the heterozygous compound. They start to feel really good and they get here and they get anxiety. But it's like pumping up a bike tire. You don't keep pumping it up, right? You stop pumping when there's enough air. So at that point, she could probably take over with food, lifestyle. You've kind of methylated her enough. Now, she may come down again if she gets sick, has a stressful situation, but you will have to work with her because they're very sensitive, okay? But I would use a bioavailable, which is in the Frontier Multi, versus a methylcobalamin or a methylated folate, which is in the Women's and Men's Complete. So it's in the Multi as a bioavailable one. Second question was, what's the difference from trimethylglycine, I'm not doing anything though, tri meaning 3, and dimethylglycine meaning 2. Trimethylglycine is just a little less bioavailable. Some people use it. What I normally say is there's more studies on the efficacy of dimethylglycine than trimethylglycine, so I use that. I didn't do it. Plus it's one more level down, so more bioavailable. And what I've noticed with trimethylglycine is if you have thyroid issues, you'll have a problem breaking it down because it requires B2. And people with thyroid issues, they don't make B2 active in order to break down trimethylglycine because it's required for the breakdown to dimethylglycine. Does that all make sense? So I would use dimethylglycine for your thyroid people. Trimethylglycine's fine. There's just less studies on it. It's not better or worse, it's just less. So, does that make sense? Yep, probably more than you wanted to know. You're probably like, I just wanted to know. Shut up, Tracy. Sorry. Sure. Okay, let's scroll down a little bit, Phil. Stop there. Okay, so as I said, you could fill DMG all the way for the red blood cell count. Easy iron, just to go over these formulas, if you're not familiar, everything's on your tables. So if you have a formula on your table, you can look at it, you can check out the panel. Easy iron is a patented trademarked ferrous shell iron. A lot of studies on the absorbability of it. Women's Complete and the Frontier Men's Complete, those are comprehensive formulas that do have the quadrifolic, which is what this doctor was talking about, the most bioavailable methylated form of folate in it. That's used in a lot of different supplements. And then Super B Complete is also another one that you could use, along with dimethylglycine. People don't normally fight me on DMG. You know, they'll put it in their water. It comes in liquid. They'll chew 1 or 2 a day. If I'm dealing with somebody that has chronic illness, a diagnosis of cancer, something along those lines, I'm going to give up to 2,000 milligrams a day of DMG. And just so you know, the studies were 4,000 doses. They gave 4,000 doses to somebody and still no contraindication. mean, I feel bad for that guy. He was probably like, please, I can't do 4,001. They probably just stopped, right? So there is no contraindication. It doesn't interfere with medications. It's very safe. Any questions here? So people always ask, how many of these have to be low or high? I usually say 2 to 3 that are in the same pattern. So if you have 2 that are trending low as an iron need, or 3 that look like there's iron need, I would give iron. If you have 1 that's low, you might want to add a multi that has iron, right? But again, you're going to go check the total serum iron, you're going to check the ferritin, you're going to look at that serum panel. But to me, if these are running low, I'm going to give some form of iron, whether it's beef liver, whether it's Ferroshell, whether if it's in the Women's Complete, there's iron, I'm going to do something, okay? Yes?
If the hemoglobin was out of your functional range, therefore you're thinking they have trouble with methylation,
Mm-hmm.
but you do have a homocysteine on them and it's in functional range, would you still use methylated vitamins?
Are they symptomatic?
I guess it could depend, usually,
Yeah, then, so that's a really great question, because again, there's a lot of power in numbers. Numbers don't lie, but they don't tell the whole story, right? That's where you're going to talk to your client about symptoms, how they're feeling. Homocysteine is the waste product of the methionine cycle, and it uses B6 and NAC to get converted back up into SAMe, into that cycle. You need some. You don't want it too low, right? So you do want some homocysteine, but if it's normal and you still have a methylation issue, it just hasn't gone that far yet. It may not affect that cycle, but it might be affecting a different cycle, cellular recovery. So I would then check out the person, ask the symptomology, and make your decision from there. I think everybody should be on some form of multivitamin with good sources of B vitamins. I don't know if you guys knew this, but I used to work at NF, and I learned a lot when I was in product formulation. The most expensive part of a multivitamin is the B vitamins. It'll be the first place that anybody skims. There either will be the wrong forms or not enough. And today in our world, being exposed to EMF and stress, we burn them up, and we burn them up pretty quickly. So I'm a big fan of B vitamins. Finding the right one for your client is crucial, especially if they do have some sort of mutation or polymorphism with the MTHFR gene, okay? But that's a good question. Never treat the test. Never treat the test. Talk to the person, okay? This is just numbers. All right, so we're going to move to white blood cell count. So I lied, Phil. I need you to scroll back up and see the top. So I didn't put the formulas in here. In every lecture, I'm like, I got to go back and fix that. In every lecture, I don't. So, but it doesn't matter because you don't have papers anyway. So, God bless your heart. Bless your heart. I'm going to take a hot second. Run, Christine, run. I'm putting this back on. Huh? She is. She was like, what do you mean we don't have any copies? I should have said that they're in my binder laminated. They are. All right, so now everybody has their sheet. So we're going to start over. I'm kidding. We're not going to do that. I'm kidding. Kidding. I know you guys have places to go, people to see. Probably have to use the bathroom, but you're not going anywhere yet. All right, so we're going to write DMG here, right? We have our little hack that we could put CircuCor in there as well for nitric oxide production, because that's what CircuCor does. We know that heals leaky gut, that heals vascular systems. A lot of people, when we look at red blood cell count and the health of cells, if they're leaking, if they have high blood pressure, if they have high sugar, that's all going to affect your health of your cells. Hemoglobin, A1C, is how many red blood cells die in your bloodstream. So when the hemoglobin A1C is increasing, that means you have cellular death of your red blood cells. Something's in your blood that your body doesn't like. Most of the time it's glucose, too much glucose, right? So we use it as an indicator of metabolic dysfunction, particularly high blood sugar. But it can be something else. It doesn't have to just be that. You will notice that A1C increases when you have an infection, right? When you're sick. Get a virus, all of a sudden your glucose goes up, your A1C goes up, it looks like you're diabetic. Why is that? Isn't that just a hormone? No, it's part of your immune system. Insulin's a peptide, right? So it's going to work in a different pathway. Okay, so white blood cell count.
Can I follow up? I have a quick question.
Yes, sir.
So if someone an insulin looks good, their triglycerides are below 100, but their hemoglobin A1C is up, you would say that hemoglobin A1C is not an accurate representation of their blood sugar for the last 4 months. You would start looking for
I would look for something else.
something else going on.
Yeah. So his question was, what if all the numbers of that person, like insulin, glucose, everything was good, but the hemoglobin A1C was going up? I would look for infection. I would look for something else that's creating that pathway. And it will eventually result in the A1C going up, the glucose going up, like the blood, it will result in that. But I know a lot of people that became type 1 diabetic after an infection, right? So just think about it. It's not always the SAD diet. Metabolic dysfunction is also heavily reliant on estrogen, progesterone. They have a huge impact on A1C, insulin. Do you have a question, or you just? Yeah, yes, you can. Yep, you can run different things like that. So she said you can look for the insulin antibodies. Lots of different ways. So as you can see, blood work starts to become super powerful, right? And once you start understanding patterns and what you're looking for, and we're no longer separating hormones over here and neurotransmitters over there and immune system here, we're looking at it as one system interacting, talking, paracrine, autocrine, endocrine, neurocrine. Now we understand that the immune system is everywhere. It touches everything, and your body doesn't have a fence. It's really important, okay? All right, so white blood cell count. I don't care what the normal range is. For me personally, anything below 5 is a chronic infection. Anything above 8 is acute. So when people come in with white blood cell counts of 10 and they get sent home, and 9, they get sent home, there's something going on. What? I don't know. We're going to look at the differentials to try to figure it out. But there is an infection. Could it be candida overgrowth and a secondary gut infection? Sure can. What about parasites when we see those in eosinophils? You know, as Dr. Bob says, everything on this planet that's alive eats, sleeps, and poops, and sometimes it's inside your body. Right? It's a really nice visual. I was like, thanks, Dr. Bob Rakowski. That was great. So, way to go, Bob. I like lecturing with him. I'm always like, you know. So, anything below 5, chronic infection. Been there a while. It's underneath. It's what I call an instigator. It's not something that you're going to be symptomatic like cough, cough, sniff, sniff. But it's going to be enough to challenge your immune system, to challenge your hormones, to challenge your neurotransmitters. That's why they call it COVID brain. People who had COVID, they got a viral infection, and all of a sudden they had anxiety, they had depression. The very first thing when people walk into my office and they say, you know, all of a sudden I had X, Y, or Z, and now I'm depressed, and I'm on Zoloft, and I'm on this, I always ask, were you sick? Yeah, I was. Why do they call it Lyme brain? Right? It's an infection. So there's 2 pathways of infections, though. Pathological associated molecular response. That's called PAMP. P-A-M-P. Pathological associated molecular response. Then you have what's called DAMP. Damaged associated molecular response. So you can have a pathogen that infects a cell, and that's pathological. And we'll use things like antibiotics in the allopathic, or in our industry, we can use colloidal silver or immune formulas, things that are going to go after that bacteria or virus, right? Colloidal silver is extremely powerful. It's studied for antifungal, antimicrobial, antibacterial, and antiparasitic. Also goes after mold spores. Very powerful nutrient to add to your protocols. Sometimes what happens is the body will take care of an infection, the pathological. But because they don't have enough iron, or they're a poor methylator, the cell doesn't die because P53 hasn't been activated, so it just kind of stays sick. It gives off the exact same help signals, red flags, as a pathologically infected cell, but it's called damaged associated. So when you have someone with damage-associated molecular response, you need to go with a fill mentality, not a kill mentality. We're way too kill it. We just want to kill everything. We're like, oh, you have parasites, let's kill them. Oh, you got candida, we're going to kill it. Oh, you got an infection, let's kill it. And so you get chronic Lyme in stages, right? You guys know it's a spirochete, and then it goes to a cyst form, then it fills with biofilm. And so colloidal silver can break biofilms. We have lots of things like garlic can break biofilms. Nattokin Plus can break biofilms. That's a product here at NF, Systemic Enzyme Therapy. So my point to all of that is sometimes when you're working with a chronically ill patient who has a white blood cell count below 5, say it's 3.5, 2.5, go with a fill mentality. When people get diagnosed with blood cancers, it's B cells that have not matured to do their job and then go die. You have a lot of like teenage B cells just running around not to know what to do. So they do chemo, they take down the B cell count, but it's not really the issue. The issue lies in a deficiency of zinc. Help those B cells mature. So start thinking about fill mentality when you have a chronic infection, because it's been there a while. You probably don't have any more pathological. And I'm not saying you shouldn't look at that, but if it's been there a while, there's probably a lot of damaged associated molecular response. That's going to be a different pathway for you. That person is probably adrenally fatigued, low in iron, low in vitamin D, poor methylator. You have a gamut of other problems besides an infection. You just have a bunch of cells that won't die or repair themselves. And you want them either healthy or dead. There's no in between. It's kind of harsh, huh? All right, we're going to move down. Oh, let me talk about support. So some of the immune support that I want you to write into that space. Very first one is SPM, Specialized Pro-Resolving Mediators. They are by far one of the greatest contributions to our allopathic and alternative health. If you don't know what an SPM is, it is a specialized pro-resolver of inflammation and of immune modulation. It gives you just enough time to get the inflammation up, to get the signals, the fire trucks to come out, and then it also modulates the immune system to calm down. So macrophage type 1 and type 2 modulation. That's what SPMs do. They are safe across the board. You can give them to women. You can give them to pregnant women. You can give them to children. You can give them to animals. I have. I gave them to my dog. Just keep in mind that you have these tools that are extremely effective. And I will dose up to 6 a day for people, even more, when they have some sort of inflammation. A high ferritin, if I see a high ferritin on a blood test, I'm starting with SPMs because it's inflammation. So I'm going to try to modulate that inflammation, even without knowing what it is. I'm going to start right there. Second one, you can use Immunomax. I don't know who has that on their table.
Right up here.
It's right up here.
Right up here.
Here it is.
It's on your table.
I can't see it because I don't have my glasses on, but I'll grab it. No, I don't think that's that. I got Estrocleanse, I got zinc,
Oh, I thought I had
Super E. That's okay. Okay, we'll talk about that one too.
Immunomax.
All right.
Here we go. I knew it was
So
up front. It's on our table.
it's right at Christine's table. Okay. So if you haven't looked at this panel, DMG you'll find is in a lot of our formulas. Remember, DMG studied for all kinds of immune modulation and methylation. Methyl groups silence viruses, bacteria, and oxygen robbers. When you don't have enough methyl groups, they get stolen from other silenced bacteria and viruses in your body. Why do you think we saw the insurgence of all kinds of past infections in people when they got COVID? So they got a new virus that came in, or they got the vaccine. It challenged their immune system. They were poor methylators, so their body tried to silence the new infection or the new vaccine, and it pulled methyl groups off of old infections. And then they all of a sudden, we had strep. We're even seeing HIV again. These things are just popping up. Where are they? I have clients come into my office with chlamydia. And they were like, I swear. I was like, listen, I'm not going to judge. No, I don't want to see anything. But listen, we're going to do some stuff about it, right? So, but that's what we saw, these old infections popping up because they were poor methylators. So when we're looking at infections, this is a great little formula. I'll pass it around if you want to look at the label. Again, I'm not afraid to give supplements. I'll do up to 6 of these a day with 6 SPMs. If you're going after something, go after it. Don't be afraid to supplement your people. The reason that they're sick is because they're deficient or toxic. The Immune Boost is a nice formula because it has vitamin D, the zinc, it also, thank you very much. I can't see this panel. C, as well as quercetin. Here's your little clinical pearl on quercetin, because we do have this in the formula by itself. If you have any mast cell activation clients, which is super trending right now, because we're just so sick that we've actually ticked off a secondary form of the immune system called mast cells. Those cells are in connective tissue. But start with quercetin by itself. Mast cell activation, you can only use 1 or 2 supplements at a time. I always choose quercetin first. And just titrate it up. Start with 1 3 times a day, then 2 3 times a day, until you get the result you're looking for. Usually, you know, if they have POTS or swollen hands or histamine response on the skin, quercetin is going to take care of that. But it's in here, and so this is a great formula. The dosage is 5. If something's acute and I'm trying to go after it, you can do up to 10 a day. Just do it with food because it does have some zinc in it. And, okay, thank you. It can upset your belly. Okay?
Tracy, real quick, can you go into just for a minute the latent infections being re-energized upon introduction of a new infection, I guess? And so when in the terrain of a hypomethylator, a latent infection was dormant, and then with the new immune perturbance, there is all of a sudden the new infection and also its old friends
Yep.
that pop up?
Yeah, because the methyl group will be pulled off to try to silence the new infection, leaving the old infection, the latent infection, to kind of give rise. Some infections, such as Epstein-Barr, have different life cycles. That's why there's 4 tests for Epstein-Barr, not just 1. There's 4 titers. So different life cycles of like mono, right? Anyone ever have mono as a kid? So here's one of the things that add to your intake. Ask about childhood infections. Ask if your people ever had strep or mono. Those are the 2 biggest ones. Epstein-Barr and strep travel together. So if I'm ever testing for strep, I test for Epstein-Barr. That's mono. So during the time of COVID, when people had these infections kind of laying down, right? Now we're talking about a population of people that are not nutrient dense and they're toxic. So they're not bringing in a lot of new nutrients, a lot of new methyl groups, which we're supposed to get from food, but we can't get it from food anymore because our food is terrible. Our soils are depleted. We use glyphosate that strips our land of minerals and nutrients. It also destroys our probiotics. It also is more powerful than EDTA for stripping minerals. So we have all of these issues, and we introduced a virus that the body hadn't seen before. And so it gave all attention to that virus or that vaccine. And if they didn't have enough methyl groups coming from external sources, your body will take what's internal and use it to silence the new infection. So those latent infections started to pop back up. Now you can give DMG to help silence it. DMG is an immune formula, just like SPMs. So during COVID, I had alphabet soup. That's how I sold it. DMG, CBD, NAC, and SPMs. That was my 4 protocol. If people were like, I can't afford everything, I'm like, here's 4 things you gotta take. Boom, 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 boom. I was like, alphabet soup. Just every day, take it. And people stayed healthy. So you have to remember the body works in acetylation, phosphorylation, methylation. Who knew 7th grade was so important, right? When we learned all these things, but we never really paid attention. That's why we're seeing turbo cancers. When you are a poor methylator, you can't activate P53. When those people have a vaccine, and I don't mean pick your side. If you know me, you probably know my side, because as says, I'm shy about my beliefs. But when they got that vaccine and they had any type of mutation or they were a poor methylator, people either got super sick or they died suddenly. Because when the body can't do something, when it can't react physiologically, when it can't defend, it dies. That's what happens. So when you're actually symptomatic, good, because you're still alive. But the way that that vaccine worked was in acetylation, phosphorylation, and also methylation. That's why N-acetylcysteine worked for COVID. Because for people that were bad acetylators, it worked for them. Right? People that were bad methylators, DMG worked for them. That's why I did alphabet soup. I just covered everything. And then you have to look at the phytocannabinoid system, which touches everything. It's like the tree of life inside your body. And so I gave CBD for that. So I just tried to cover everything, right, with alphabet soup. So that's kind of the high end. I have a whole diagram I'll show you after this that I drew how the vaccine actually affects the body.
The what?
How the vaccine affects the body. The shot. Yeah, it's not a vaccine. I'm sorry, the bioweapon. That's what I meant to say. Sorry. Sometimes I don't know how up on the conspiracy theories my audience is, but I see we're all in the same place. All right. So SPMs, Immunomax, obviously vitamin D. Don't forget about IgG. I know everybody puts it towards gut, but it's an immune peptide. It's going to activate certain parts of the body that you need. So IgG powder. Remember, all health begins in the gut. Don't be afraid to help somebody's digestive system. If someone walked in, tells you they were super sick, and now they're on Prilosec, hello, right? Go to the gut. Okay, so let's move to the bottom. Now these are differentials. Keep going a bit, Phil. Just put down, leave neutrophils at the top. There you go. Okay. So your differentials here, neutrophils, lymphocytes, monocytes, eosinophils, and basophils. Neutrophils are going to tell you about bacteria. What kind of bacteria? I don't know. Look at symptoms. You can run more tests to discover what that is. I like neutrophils between 40 to 60%. Over 60, I know I have something going on. Below 40, I know that it's being repressed and probably another part of your immune system is activated or you don't have enough. Remember, autoimmune or immune repression are just as dangerous. If you can't defend yourself, or autoimmune, where they say your body is killing its own cells, which isn't true. There was actually a journal, the Journal of American Medical Association. I think I'm the only one who reads it, but it was the psychiatry edition. A bunch of psychiatrists got together and tested their people that had mental health issues. And what they found was 90% of them had a latent infection. 90%. So think about strep. What does strep cause? Pandas, right? Pediatric acute onset of neurological, like blah, 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 right? So these kids all of a sudden get a strep infection, and then they get OCD, anxiety, depression, just like that. Eating disorders, exactly. Think about it. Chronic ear infections in kids, look at strep. Chronic sinus infections, look at strep. I know the whole world is on mold right now, but I'm telling you, after COVID, strep raised. And so what I see in my clinic now are all these kids suddenly depressed, anxiety, suicide is out the door. That is not just a mental issue from depression, from isolation. It's activation of latent infections that we're not asking about as practitioners. It's the first thing I ask, did you ever have strep or mono? And if someone says, yep, I'm going right here. I'm going to look, neutrophils and monocytes. And then I'm probably going to test for it. Now that test costs about $25 to get Epstein-Barr and strep tested. It's not expensive. So my point is, in that journal, they found that there was something called molecular mimicry. And what that means is on a cell, whether it's a bacteria or a virus, and on your cells, and on proteins or carbohydrates, there's these sequences called epitopes. And they're like a chain of these little sequences, like A, B, C, D, E, F, G, A, B, C, D, E, F, G. That's how they isolate viruses or bacteria. They measure these epitopes and they isolate, this is the genetic pattern of it. Those epitope sequences on strep are the exact same epitope sequences on the neurotransmitters of your brain. So when the body starts to kill the strep, it starts to attack the neurotransmitters of that kid's brain. So that's how the body works. If you have enough of X, Y, or Z, and the immune system is healthy and you're not toxic, your body will kill off the bacteria. You might need an antibiotic for that. I'm not anti-antibiotics. But then you'll be able to repair those neurotransmitters, and your body will be able to modulate the immune system and recognize your own tissue. But if you don't clear that infection, or it's latent, or it lays there too long, you start to get this molecular mimicry pattern. That's what happens with Hashimoto's and Epstein-Barr. 80% of the people that they studied with Epstein-Barr or with Hashimoto's had underlying EBV. And so the epitope patterns of Epstein-Barr look exactly like your epitope patterns on your thyroid cells. So you start to get Hashimoto's, autoimmune. So here we are looking at an issue that's hormonal, but it's really infection-based. So just from a simple CBC, which this test by itself costs $5, $5 to find all this out about your patients and clients. So when I look at neutrophils and infection, I'm looking for bacteria. I'm going to ask questions. Did you ever have strep? Were you ever exposed to Lyme? If they say no, they have gut issues, I'm going to be looking for SIBO, H. pylori, Candida, something that's going to create bacterial issues.
I mean, everyone's had Epstein-Barr and strep, so what do you consider a positive IgG? I mean, they're usually not IgM, but
Right.
So an IgG above
Yeah.
400? Or?
Well, if it's flaring and they're symptomatic. So that's the thing about Epstein-Barr. It can be activated by other things such as Lyme. So you get a Lyme infection, it can activate underlying Epstein-Barr. He asked, when do I start to worry about it? If they're symptomatic. So if they're having low iron, they have fatigue, chronic fatigue, they have other symptoms that are going to mimic Epstein-Barr, then I'm going to start being concerned about it. But if I see monocytes over 7, okay, I know it's an underlying virus. Most of the time it's going to be Epstein-Barr, and I actually, on this number, I'd probably take it to 9 or 10. That's when I'm going to go in and do a secondary titer, if I feel I need to, on Epstein-Barr. And I teach that in the advanced course, and we'll be talking about that in October. So for underlying monocyte activation, obviously there's lots of formulas that you can utilize, L-lysine, because we have to remember that all of these viruses, herpes, Epstein-Barr, they're envelope viruses. They respond really well to things like L-lysine. I know people worry about the imbalance of L-arginine. If you worry about that, you can add Circucor to it. NAC, zinc. I do love LiveClear. If you look at the panel on LiveClear, it has a lot of amino acids. There's a lot of pathways that it helps with alpha-lipoic acid in there. It's going to help balance all the other things that get affected by Epstein-Barr, such as the hormones and the neurotransmitters. But that's the thing. Part of what we do, and he has really good questions, is not giving you a solid number saying at 450, I want you to go after this. We are still the practitioners. You're still the Perry Mason of that person's health. You have to figure it out. Some people are symptomatic at titers of 200, and some people aren't. Some people are symptomatic with a TSH of 1.6, and some people aren't. You have to be a practitioner. This is your guide to give you clues into that person's health, immune system, red blood cell health. But if you have a client that comes in and says, I'm feverish, I'm achy, I don't know what's wrong, this happens to me every December, and you run a blood work test on her and she's at 10, I'd probably go after Epstein-Barr. I'd probably ask her, did you have mono? What did they do for it? How's her iron stores? What's her methylation potential? I'm going to look at this comprehensive metabolic then. I'm going to look at the albumin. I'm going to look, does she have leaky gut there? What's her adrenals look like? Maybe she's had this underlying infection so long and it's flared for so long that she's adrenally burnout. Now her estrogen's falling. Now her progesterone's falling. Now we have a gamut of issues. So we may not have to kill this as much as we have to start rebuilding her. We have to fill her. And eventually, her body will methylate this again and silence it. It never really goes away. It's just about our body overcoming things and being able to keep it under control. Because, guys, we're never going to get out of this planet until our last breath, right? So we're always going to be exposed to all the things. So it's really about, it starts at your fork. And there's two things you can't outrun, your fork and your thoughts. So all of this stuff is great, but you got to be talking to your clients about lifestyle. You have to be talking about nutrition, hydration, movement, sleep, elimination, emotional, spiritual wellness, all the things. Okay, lymphocytes, I kind of jumped around there. Above 30 is an underlying virus. Again, think of your antivirals. You know, vitamin D3 should always be checked. And I like vitamin D between 50 and 100 on blood serum. This 30, I mean, who do we know it has rickets? Like nobody. That's where that came from. You know, RDA, those recommended daily allowances, as Mike G always says, they're just really dumb amounts. We need to rethink it and redo it, right? That's what he always says. It's one thing that he said it was like correct and funny all at the same time. I was like, way to go, Mike G, you know. He's one of our reps if you don't know Mike, but he was my rep. So don't be afraid to nutrify your people, because what's happening is we don't have enough in our savings account for when crisis strikes. We have enough to survive every day. We don't have enough to thrive every day. And that's what we have to start building towards. You know, self-health and thriving so that people can have enough when they get sick. You're going to get sick. You're going to get exposed to stuff. Things are going to happen. It's whether or not you recover. It's like in the fitness industry. People will come in and be like, oh, yeah, you know, I can run 5 miles and I can put up 400 pounds when I bench. No one ever said that I knew. But anyway, if they did, they were lying. Then I'd say, well, how long does it take you to recover? And they're like, oh, I'm sore for days. That's not fitness. That's destruction. If you can't recover, you are not healthy. You have to be able to recover. Okay, so eosinophils, anything 3 or above, parasites. Now, parasites and food sensitivities go hand in hand. Remember, everything that's alive in your body eats, sleeps, poops. When that starts to build up, when they are stealing your nutrition, okay, and they are creating waste, and you have leaky gut going on, which you can see in the comprehensive metabolic, and that's leaking into your bloodstream, now you're getting a secondary immunological response, now you're getting inflammation, and you're deficient. So you are going to be sensitive to everything. And so people will eat very clean, and they'll come to me and they'll be like, I don't understand, I don't eat anything. And we start putting people into food prisons. I love food sensitivity testing. It's a wonderful tool, but it's not a lifestyle. You can't keep somebody on a low oxalate diet for the rest of their life. Fix their hydrochloric acid production, fix their liver. You'll fix the oxalate problem. Can't keep people, this whole gluten-free does not mean healthy. It just means gluten-free, because you can eat a lot of corn-laden products that have tons of glyphosate, and you can really do damage to yourself because you're not taking in any nutrition. Stop saying gluten-free. Start saying whole food. Non-GMO. I always say tree, ground, run, swim, fly. Falls from a tree, grows from the ground, runs in a field, swims in the ocean, flies in the sky, organic, non-GMO, you can eat it. Figure out what you like. I'll see you in 3 weeks. That's it, right? If they need more protein, tell them to eat more protein. Women, you need protein. Quit eating all these grains and filling yourself with stuff that has no nutrition. Muscle is medicine. You want to get glucose into your cells, amplify your AMP pathway. That only happens with strength training, only. All this semaglutide that's out there, it's great. It's a tool, right? We have nutraglutide. We have glucose. But when you exercise, you push glucose into the cells without spiking insulin. Isn't that what we're looking for? Right? So muscle is medicine. I learned that from Nikki back there. There's a little trainer back there. She's awesome. So just keep in mind, there's more ways that you can help your clients just by looking at blood work to talk around not just what you see on the paper, but how are they eating, sleeping, moving, thinking, right? As Bob says, eat right, think right, move right, poop right, pray right, all the things right, and you'll have a pretty right life. So when we're looking at food sensitivities, I would do parasite cleanse first, only if they can methylate. So you're going to work with the fill mentality first, and I usually say to my clients, we're going to build you for 2 weeks, and then I'm going to send you your parasite cleanse. So I want you to go home with this multi, this probiotic, this additional thing that was low in your blood work, and this additional. So they leave, and for 2 weeks, they're nutrifying, they're changing their diet, they're thinking it through, and then I'll send them the parasite cleanse. And now their body is ready. It is able to. Okay? Basophils are also another indicator of parasitic. So if I have eosinophils at like 2.5 and basophils of 1, parasites. Now, there's 4 types of parasites. There's helminths, there's flagella, there's all different kinds. It doesn't necessarily mean gastrointestinal. You can have co-infections of Lyme that is parasitic. You have to kind of figure out what that is, and that requires more questions. But Parakill, Microgon, covers a lot. I also love to put in superbiotics. Remember to fix the gut. People like to kill things but not fix them. So we kill the parasites, but we don't get the integrity of the digestive system back. Okay, GI Complete is a great formula. It's a comprehensive formula, great for inflammation, has about 5,000 milligrams of L-glutamine, which we know is very beneficial. I add Circucor to this, IgG. So you have yourself a little protocol, okay? Just some key notes down here. Neutrophils to lymphocytes, so bacteria to viruses should be 2 to 1. You should always have, 60-30, something along those lines. It's not always going to be perfect. But if you start getting a 1-to-1 ratio, you're looking at autoimmune somewhere. What it is, I don't know. You have to figure that out. If you have different conversion factors, if something's in like an absolute value, this is just a conversion for you. You take that absolute, divide it by the white blood cells, and multiply by 100. That should give you your percentage, okay? Any questions? Go ahead, John. Journal of American Medical Association Psychiatric Edition. And it's called, the article was called Molecular Mimicry.
And then related to that, you mentioned like strep mimics the neurotransmitter code, right? And I think you said mono, Epstein-Barr mimics
Thyroid. Mm-hmm.
Um,
It's not always the reason for Hashimoto's. Here's the other thing. Gluten has the same epitopes as your thyroid cells. That's why people that have Hashimoto can't eat gluten.
So in that article, does it discuss if there's other epitomes from other viruses that are in other areas of the body's function? That was sort of the...
Yes. Yeah, they don't
Okay.
put it out in great detail, but what they recommend, they actually have a test that they developed for this. It's a very specific test. I can't remember it off the top of my head. But they recommend IVIG as one of the main components, and PRP. So replacing the blood, if something is chronic. Now, there's a couple specialists that I work with kids that have pandas.
That's my next question.
Yeah, so I refer them out. I'm cutting out, I don't know. I do refer those kids out to specialists if they need things like IVIG and PRP.
So 2 of my daughters, when they were 10 and 12, started having seizures.
Okay,
And there was a chronic strep that wasn't properly treated.
gotcha.
I was curious, you mentioned neurotransmitters was part of the epitome for that.
Anything can
Could
cause
it
anything, yes.
Cause
it
the
could.
seizures?
Yep,
Okay.
could also have been other
And
things.
quit eating so much sugar, right?
Exactly.
Yeah, I
And, stop vaccinating your kids. Not that you did, just saying. It's just a statement into the universe. Yeah. Sorry. I know. Okay. Micro.
Dr. Jennifer Franklin, she is now in Peachtree City. She used to work here maybe at Center Spring, but those of y'all that know Center Spring. She's a functional med, MD, pediatrician, and she specializes in pandas. If any of y'all have locally someone to refer to, and she says she refers out, she sometimes comes to these dinners. She's not here tonight.
That's great. Beautiful to know. Yeah, it's these psychiatric conditions we're seeing in kids. My statement, personal, not a belief of NF, it's mine. I believe childhood vaccines are the gateway drug to a lifelong pharmaceutical user. I think they're one of the worst medical frauds ever to hit our planet. There's no safety test. They do nothing to stimulate the immune system in a good way. And there's never a time in your life that you're exposed to 3 to 6 viruses at one time in your life, ever. But we'll do it to a baby.
Yeah, the cytokine storm doesn't allow that.
Huh?
Evolution. The cytokine storm that you have after you have an infection keeps you away from the rest of the tribe.
Right.
This is taken all the way down to earthworms.
Mhm.
An earthworm with an infection will remove himself from the rest of the earthworms. It doesn't even make sense through evolution that you would get 3 infections at once.
Right.
I mean, ideally.
I'll get it going in here. We'll just get it going. You should have saw me last night when I came into the bar. I was like, hi, and this guy's sitting there. I was like, so what do you do? And I mean, we went all the way back to the 1986 Act, and I was like, oh yeah, so let me tell you where that came from. And he was like taking notes. So I was like, bet he was sorry he sat down next to me. I met John at the airport. I spewed all over him. I don't even know this guy. He came in. He's like, I met at the airport last night. I was like, you should just come to the event. You're just gonna learn so much. So he is here.
Awesome.
Well, he's in the Atlanta area, so any of these functional practitioners right here's your choice. You have the best of the best sitting right here in this room. This is who you call. And what was your question?
I'm coming.
You talked a lot about people who, you want me to just speak louder, or you want me
I think they want it recorded, so.
We're recording this, so
Gotcha.
if you don't do it, we won't be able to.
Gotcha. You spoke a lot about people who don't have enough methylation, but I was wondering if you just speak to the concept of over-methylation, especially with a lot of products coming out with very high amounts of methylated folate, methylated B12, and how do we watch for that, that type of stuff?
Yeah. So I'm not going to claim to have all the answers, but for me personally, I use different forms of B vitamins. So for people that are heterozygous compound, I don't usually use methylated forms. I use bioavailable forms. So they're bioavailable, but you have to watch them. So it's almost like you give them the nutrition that their body needs, but it's so fast and it charges them so fast that they start to over-methylate, which is the term, which means basically you're igniting all the excitatory neurotransmitters in their brain way too fast. It's usually a deficiency in the other neurotransmitter pathways. That's one of the things that we don't always test, and you should. You should test neurotransmitter pathways for your MTHFR patients. And you can do that with a test kit at home. It costs about $89, and it's a urine kit. Now, some people will say, oh, urine doesn't count. It does count. If you understand the neurotransmitter pathways, and I'm going to be talking about this in October, every single neurotransmitter pathway you have requires B6, iron, and magnesium. Those are your three base essentials in every neurotransmitter pathway. Outside of that, you could have things like copper that are needed. And those nutrients are needed for amino acids to break down into more usable forms and then to be metabolized out of the body. So when you're driving in B vitamins, you could be driving an excitatory pathway because it's deficient in something and it can't break it down to something else. Which pathway? I don't know. So we would have to look at it. So if you have that issue, I would probably cut down the B vitamins, watch it like a parabola, and cycle it in. Tell them, like, we're not going to keep going up. When you start to feel that anxiety coming on, we're going to drop your dosage down, right? Because they don't need as much as that. Let their body stabilize. And they might have to adjust because they have a mutation. So they might just have to be a maintenance case like that. But you have to teach them that, like to know their body and to be able to adjust it accordingly. So.
And the dimethylglycine, does it have the same?
It can.
Okay.
It can. So you got to watch it. So usually if someone is a heterozygous compound, right, we have the polymorphism in both, I'll start them with maybe half of the dose. So I always use the liquid because you can control that. Some people get to 1 or 2 drops and that's enough. You just have to walk it.
Which homo or heterozygous?
Heterozygous compound, so that's the 1298C and the 677.
For MTHFR.
Yes, for MTHFR. So that's having one of each. If you're homozygous, then you have 2 of the same, 677, 677. If you're heterozygous, you'll have 1 copy of the same type, so like a 129 or a 677. The heterozygous compound is the most sensitive and the most problematic because it causes a 70% reduction in your ability to convert folate to its usable form and a 70% reduction in your ability to create homocysteine and detoxify and make glutathione.
Can you, what is your definition of a bioavailable B vitamin?
It's in the Frontier Multi. They have a bioavailable B.
What does that mean?
It's just not, it's not a methylated form. So
Is it hydroxy, adenosyl?
No, it's not hydroxy, but hydroxy does work for overmethylation. You can use that, like a hydroxy B12.
Okay.
That works
Okay.
well.
And my
Breaks down. Go
my
ahead.
second question is, how do you address transsulfuration? Because no matter what's happening in the methylation pathway, for better or for worse, it's ultimately going to affect transsulfurations because it's feeding it.
Right.
I know N-acetylcysteine has the cysteine. There's your sulfur group. Is there anything else for the?
So N-acetylcysteine. Yeah, I don't want to go that far. I want to talk to her. N-acetylcysteine and B6 come together to help form glutathione. So I would look at the B6 pathway. Again, remember what I said about neurotransmitters, right? It runs in that pathway. And sometimes you have to add some glutathione at the end just to get them over the hump. The Emothion. So you could utilize that. Now that's in the lean greens. If you needed an isolate, then you would have to, glutathione doesn't taste really good. But you could utilize that to help.
Do you have anything with Biopterin or BH4?
I don't know. I don't think so.
Okay, that's fine.
Yeah, but we can look at that if you're looking for a formula. That's the kind of stuff we want from you guys, like what are you looking for? That would be great.
Yeah, our Live Complete also has the glutathione in it if you want somebody with a capsule
The
as opposed to a
Emothion,
powder.
yeah.
The Emothion, sorry.
Go ahead.
I had a question about Parakill. For children, how low of age could you give Parakill to it?
I usually use Microgon for kids. They fight me a
Microgon.
little bit less. It's a tincture. Yeah, so it's an herbal tincture, an herbal blend.
Oh, I see.
And I'll use that for the kids, along with probiotics.
Okay. And then regarding Air Max, also for children,
There's a chewable. Strawberry Fields is the best. It's
but what
very
age?
delicious.
What age, the lowest age?
If
Chew.
they can chew, give them
They
one.
can chew, it's okay.
Yeah, and you don't have to give them the whole thing. Bite it in half, have them on bite it in half,
Okay.
so. But usually a quarter of the dosage for children, under the age of like 10 down, some depending on weight. My 10-year-old's 5'2" and 120 pounds, so he's getting a whole one. But for kids that are smaller, quarter of a dose and then half a dose for, because everything's based on a 150-pound person. That's how they put out these dosages. So adjust down from that. So.
But back to just Parakill, I just wanted, because I had a
Yeah.
lady come in with children that, she claimed had parasites, and she wanted to buy the product. She's saying, well, one kid's 7, the other is 11. What should I do? I said, well, I said, it's hard to advise that. I said, 12-year-old's probably okay because they have full liver development. The 7-year-old, I worry about.
Yeah, I'd probably use Microgon for the 7-year-old just
7.
for, it'd be easier. You could adjust the dose.
Okay.
For the 11-year-old, the Parakill would be fine, but I wouldn't do the full dose for him. I would
Like a
probably
half.
do half the dose for him or her.
Thank you.
Yep. Doctor. He's got the drumstick. Thank you, Atlanta. Good night. No, I'm just kidding.
I am not giving you the mic. I'll never get it back.
Oh, gosh. Wait, let me sit
know who
down
I'm
for a minute.
dealing
I'm
with
going to
over
sit
here.
down for a minute.
Okay. So I gotta ask. So where do you want the IgG levels? What is considered negative on an IBV? Because EBV, I've run a ton of them and they're always positive. There hasn't been a single
Right,
time it's
you
ever
just got to
been.
watch for flares. So you were at the bar when I said that. So when
I actually think he was outside talking to a patient.
no, he was at the bar. I watched him. So
So that
I tried to cover for you, man.
all right.
what I said was, some people are symptomatic at low IgG, and some people are symptomatic as it's higher. I would go with symptoms with Epstein-Barr. There's actually a really good book. Give me a second. It's written by Dr. Kasha Kynes. Yeah, EBV Solution. She has a great book. So she talks about the 4-titer test. She talks about it being like this underlying infection that no one really wants to talk about because there's no tangible level to be like, at 450, we're going to go after it. It's just not. Everyone's very different. And it creates so many compounding issues that a flare might not actually be an infection flare, but it might create a hormone issue or a psychiatric neurotransmitter issue or a depletion in iron or whatever that looks like. So I can't give you a number. But if I do have a positive IgG, then I'm going to look at the symptoms of that person, and if they match, this is flaring, this is your flare number, and I'll tell them that. This is the number that affects you. and it may be different for somebody else. But if they are symptomatic and it's 200, then that's where they feel it. So it just really depends on the person.
But you're doing broad spectrum antiviral and immune support. So, I mean, there's millions of
Well,
viruses that we're exposed to every second.
I don't do just broad spectrum. I do a lot of homeopathy that's specific
okay.
to EBV.
Ah,
It's not a
right.
product company that NF carries, but it's complementary. So there is SSR kits, symptom series relief kits that I use that have the EBV protocol, Lyme protocol, strep protocol. They're all homeopathy. So that's DesBio, in case you care. Sorry. Sorry, Christine.
And then while I'm at it, the urine test, that's $89. These are metabolites of neurotransmitters, not the COMT or
Correct.
CBS or
Yeah,
whatever.
you would do that a different way.
Okay.
Yes.
Well, you mentioned a $89 one. What is that way?
That's urine. Yeah,
I
it's a
know what-
metabolite. Hmm.
What exactly is that called?
Oh, I'm sorry. It's by ZRT Labs.
Oh, the ZRT.
ZRT Labs, neurotransmitter
Neurotransmitter.
tests.
Got
Yes. Okay. Yep. And they have that on Avexia, and they have that on all the other places. But you can get a straight account with them if you want to. Anybody else?
All right, well, Dr.
Bar's
Tracy.
still open.
I think what we'd like to do, first of all, is thank Dr. Tracy for an amazing
Okay.
presentation.
Let Oscar run the quiz. Give the man the mic.
We also want to let you know that if you are interested in learning more, Dr. Tracy only gave you a modicum of her course. And her course is available on Nutritional Frontiers website. You can go on under education and click Beyond the Blood Work. It's a 4-part course that's available to you. And if you're interested, you can sign up, and it is virtual, it is complete, and you are able to get a login and download materials right away. So if you're interested in going deeper in this topic, not only completing this course, this is really a prep course to what she's going to be talking about in October during our professional training event. Again, that is live streamed as well, and you can sign up for that on our website. Under education, you can sign up for the live stream if you are not going to be with us in person. And I highly recommend that as well. So one of the things that we always like to do is we like to give products away. Since we don't want to carry all these around. No. We want to make sure that you walk away not only with incredible knowledge, but with some of our formulations. So what we're going to do is Dr. Tracy's going to ask a question.
Okay.
If you know the answer to the question, raise your hand. Then I'm going to come around to you and you're going to tell us who you are, where you're from, your practice, and you're going to pick one of our pro colors, and I'm going to ask you a question.
Jesus.
Okay? It is so
That's like a
hard.
lot.
So hard. Oh my gosh. All right, you got to earn your prizes, okay?
guess.
You got to earn your
Yeah.
prize. Okay.
All
So if
right.
you know the answer to Dr. Tracy's question, raise your hand.
And then you'll have 10 push-ups. All right, what's the universal product that can be used down the entire side?
Oh, I know.
Jeez.
Okay. I saw your hand up. Go first. Okay. First, tell us who you are.
Jessica with Dr. Alexander's office, IU Wellness. The product is, I'm going to say lean greens.
No, but I like your answer. That is one of our top sellers. That is a good effort. Okay, all right. So I want you to, before we go,
think everybody
since
should
you
win a
said
prize
lean
that
greens,
tries.
since you said lean greens, your secondary question is, what did you want to be when you grew up, and what did you wind up being?
Oh, so I wanted to be a pediatrician, and I'm 10 months away from being a nurse practitioner.
Woohoo! Nice work, lady. Awesome. Well, thank you for coming tonight, and I appreciate you trying. Proline Greens is great. You can try some back there. We have chocolate with us, and we also have apple. And if you like, I will let you take home the open chocolate one, or
You get half a prize.
or the full apple one. Okay, since
job.
you did bring that up, I will get it to you.
No one answered the question yet. Who knows?
Hold on. Oh, going to Dr. Board. Saw her hand go up.
She's running. It is DMG.
Say it again.
DMG.
DMG stands for damn mighty good, or darn. I'm in the South. Darn mighty good. Okay. So you are
I'm Dr. Elizabeth Board with Atlanta Functional Medicine.
awesome. And how many years have you been practicing?
Functional medicine for 12 and a half years.
Awesome. I'm going to ask you to pick a Pro Color.
I'm gonna be like, what's the next? Here's the next question. No, I'm just kidding.
One thing, they all have spirulina, don't they?
What does?
Oh, really? Yeah, okay, I'll
Okay,
take
so-
the blues, the purples.
Purples.
Okay, so what is the best advice your parents ever gave you?
Leave when you're having a good time. Then you'll come back. Then you'll want to come back.
Oh, that's very good advice. I love
Sounds
that.
like
okay.
every guy I ever dated.
So, Rhonda, you're supposed to be following me and handing her a prize. I'm like, we're working on it. We're working on it. Liquid DMG in the back of the room. Someone's pocketing it. Someone's pocketing it.
You know what? Yep. That's how I got started with DMG. I had a failure to thrive baby. Came into my practice. I called Mike G. He said, give it a whole dropper full of DMG. I said, you don't have kids, do you? He's like, yeah, do it. So I did. And the mom called me the next day. She said, I don't know what you gave, but he's doing great. He's crawling. So she came in and bought every bottle I had. That's how I got started. Uh-huh. So you're just putting that in your purse? That's what's happening.
You're welcome.
No purples? So you can't have the DMG either because she's going to take it. So just tell me what you want. We'll think of yeah. Oh my gosh, then you can't. So, okay, so the reds are like full spectrum. Great for kids as like a good multivitamin. The Proline Green, phytonutrients. It's a natural detoxifier of heavy metals.
Of course we have
because it has
purples, for
spirulina.
goodness sakes. I know, I should take a photo. I know, Phil.
We finally have one. This is good for circulation and brain.
Okay.
Yeah, resveratrol. That's our youth color.
Love it. Yeah, it's part of our,
like the
if you've
longest
looked at our
Q&A
quarterly
ever.
focus, part
Next
of that
question.
is healthy aging this quarter. So those products are on sale. Now, you guys all have the advantage of having the entire Nutritional Frontiers line on sale just for you for a week.
You know what I feel
Okay?
like? I feel like we're on QVC. So
I
who
know,
won?
just right now. I know, especially with that mic on.
I'll
You
be like,
have
what did you
that
think
in your
of it, Rhonda?
packets. The code is in your packet. Okay,
All right.
what you got?
What's my alphabet soup? Who remembers?
Oh,
Right here in the blue. She was up first.
coming, baby. Okay.
SPM, DFG, CBD, NAC.
Oh, shit, that's amazing.
That is amazing. You know what? I don't remember it half the time. I'll call her. I'll be like, what was it? Sure.
Okay, so would you tell everyone who you are
Alexander
What do you have on
with
your
IU Wellness Center in Alfredo.
and how many years have you been practicing functional medicine?
There's the creatine you like.
6 years.
6 years? Yeah, but you've been doing this a long time, right? You've been helping
This is a
people
joke.
forever.
Yeah.
We'll get the naked line.
Okay, then pick a pro color for me. What color do you want?
Red.
Which is your favorite Nutritional Frontiers formula that you personally use?
Ooh, this
Jeez.
the I one.
2020.
You use 2020?
And the omega-3.
Oh, very nice.
2020
All right.
is an incredible
So,
antioxidant and anti-inflammatory, by the way.
Oh.
And Glutamax is also studied for brain.
You made that
So it's
really
good
easy for
brain
me.
injury.
Okay, next question.
Oh. Which of the differentials tells you about bacteria?
Oh, behind you, coming. Hold on. Hi.
CBC.
That's the test. It's on there. Which of the different?
We got to give her credit. We got to get her credit for
I'm
that.
gonna give her.
Neutrophils.
There you go.
Oh, outstanding. Okay, she gets 2. She answered 2 questions technically.
jeez.
Okay.
You got half a jar or something, and she gets 2 products
Would
for
you
being
share
wrong.
with us who you are and where you're from?
I think
Stephanie Cuny, and I am
I'm
from
gonna slip you
Houston,
some
Texas.
products.
Oh, very nice. And what's the practice you're associated with?
Ooh, wow, nutrition.
Ooh, wow, nutrition. I like that. That is so fun. Okay. Would you like to pick a pro color?
Blue. Is blue a choice?
Well, it's purple, but that's okay. What is the best advice your parents ever gave you?
God, this could get so dysfunctional with some of
Yeah,
our.
not
right?
a, now
I'm
not a
Gen
single
X.
thing
Let's
comes to
just
mind,
start.
and I'm like, oh, my parents were horrible. Probably just being down to earth.
What'd she say? Wait, repeat it.
Nothing comes to mind. My parents were-
Think of anything, and then I thought my parents were horrible. But then I was like, I can't think of a single piece of advice. But just being down to earth, relatable, be who you are. Don't try to, be over individuals. Just be yourself.
Okay. All right. Good advice. Be yourself. All right, Dr. Tracy, what's the next question?
Oh, I didn't have one. All right. When looking at neutrophils to lymphocytes, what's the ratio that indicates?
I got to go somebody who hasn't answered a question.
Finish my question. The velocity of a laden swallow. No, I'm just kidding. That indicates autoimmune. That's right. What's your favorite color?
Did you finish?
It's autoimmune. What ratio?
Okay.
So you put your hand up because you didn't know my question.
What do these two have?
Neutrophils
All right,
to
I'm
lymphocytes.
gonna come over here. I'm gonna come over here. Okay.
You could have looked in
1 to
your
1.
paper. Yeah, but she said it. Oh no, you guys can totally cheat. You have your answers right here. She's correct, yeah. But I think she
right.
knew too, so she could get that DMG for that 9 months.
Okay, here we go.
I got it 1 to 1.
Put that in your purse,
I know you
woman.
will.
How many
now I have
times do I
another
have to say it?
Yes, you have to tell everyone, first of all, who you are and what you practice.
Elise Jones-Bailey, MD, Buckhead Functional Medicine. 10, 11 years now.
Awesome. Okay.
She's amazing, by the way. Like
She is amazing.
She is
She
amazing.
smells good too.
Oh, does
I don't know what
she?
she's wearing,
Yummy.
but it's good. Okay, can you pick one of our pro colors and I will give you a question?
she smells. You smelled.
Did anyone pick the green one?
Did anyone pick the green one? Yes.
Do we have the green one?
That's okay. We can.
Double fisting.
What did you want to be
Excuse
when
me,
you
Mike.
grew up?
A secretary.
Aw, and you became an MD.
Well, I'm kind of a secretary too, really.
You're your own secretary now, right? Yeah.
It's funny
All
how
right.
you get into medicine, you have to become like a marketer
Oh,
or
yeah.
social media influencer.
So you can give her whatever product.
Take the Power Fuel.
Power Fuel is pretty good. It's pretty good. Yeah, do it. Power Fuel's an awesome one. Yeah, for those of you who don't know, this past weekend I was competing in the Florida State Tennis Championships.
Nice.
Oh yeah, I know, right? And so one of my go-tos is what we just handed you, is the Power Fuel. They were held in Orlando, Florida. You guys may know it is in the 90s, about 90% humidity, give or take, and about a little over 100 on the court. So prior to going, I'm like, all right, guys, I need more than just my Dreamsicle shake, which is our Super Shake Vanilla, our Orange Pro Oranges, and our Orange Power Fuel. So I added Super Creatine this time. We talked about how muscle is really important, right? That really helped with recovery, and it was so funny. People are like, oh my God, how are you not sore? I go, I've used all the products. So when you talked about recovery, that really hit home for me.
Yep.
Now my team finished 8th in the state. Not bad, but not exactly where we hoped to be. But it was the 18 plus level, which means I was playing against people that are younger than my children, which is just crazy when you think about it. But we did pretty well. It was fun.
Anybody in here have clients or patients on semaglutide? Okay, if you do, you should stack them with branched chain amino acids and creatine.
Yep.
The 2 nutrients they need. Yeah.
Okay, coming back.
I
Hold on,
probably won't
so
have
people
an
can
answer,
hear.
but yes, you can.
Is that
Uh-oh, we're
you know,
getting into
when
this
you use GLP-1s and GAPs for that population of people that are diabetic or insulin resistant or pre-diabetic, there's usual renal insufficiency. So you get in a little bit of trouble titrating that creatinine, at least I have. Any advice on that?
Well, the good news is our super creatine does not convert to creatinine because it is buffered with magnesium. So you don't have to worry about that. Look at me looking smart. How about that, huh? All right. Okay.
What about creatine in liver?
Well, I mean, it's
It's the buffered, so it's not going to hurt it.
So if you look at ours, it's creselazine. You have to look at the studies on creselazine. It's amazing.
Yeah, and I mean, that's the other thing is you need less, right? A lot of times with creatine, you need loading doses. With
So I
this,
shouldn't
you
do 2
don't.
scoops.
Yeah.
I was doing that.
See that? So good. Okay. Say it again.
They do.
It's super creatine. And if you
That's
answer a question, I'll give it to you.
Yeah.
Dr.
And this one tastes
Dr.
pretty good.
Tracy,
What?
Come on.
Oh, wait.
Come on.
Drink.
You can drink your wine and ask your questions.
I just don't want to spill it. No.
All right, come on, here we go.
Wait, have to ask him a question? Or he's
Yes,
asking
you
me
need to ask him a question.
Okay. Who was? I do. I'm
has to
so
come up
tired.
something good.
I'm tired. Yes, I said
You're allowed to. This is an open book quiz. Okay.
All right. Let's see. What formula did I say for white blood cell count that you could use first to cover
It
a
was
multitude of
immuno
things?
Something, and immuno something. They're new to me. Oh, it's not on here.
It was part of my alphabet soup. There's answers over there.
Immunomax?
That was one, but not the one I said first.
Yeah,
I see
the-
who's-
It-
There's
Oh,
shouting
you-
answers. SPM, there's product for everyone. I'm so proud of all of you.
Oh, well. That's all right. Didn't make it. That's okay.
But he did.
Okay, so who are you?
Dr. Dan Cuny,
And what's your practice?
Dr. Dan Wellness, Customized Clinical Nutrition.
Awesome. And how long have you been practicing?
What year is it? 2024? So 23 years.
Outstanding. All right, think about all
That's
those
awesome.
people you've helped. That's amazing. Will you pick a pro color?
Sure. Why don't we go with red?
Okay. What is your favorite Nutritional Frontiers formula that you personally use or will use if you haven't used our products yet?
I understand.
Well, now it's going to be SPMs after what I heard tonight, but
That's right.
and dimethylglycine. But right now, let's see. I was trying the thermogenesis for a while. I liked it, but I like the inflammation one. It's called. I just started it.
X-Flame?
X-Flame. Yeah, it seems like it's working well.
Awesome. Well, that's also part of my recovery. So you heard Dr. Tracy talk about SPMs. So I would take 3 SPMs, 2 HA+, and 2 X-Flame. And that's really my bone joint inflammation matrix. Okay,
Nice.
so if you are a chiropractor like my friend and colleague right here, Dr. Tim Gross, you will want to use those 3 formulas in combination together because they really help. So the SPM manages the inflammation, HA+ lubricates the joint, and X-Flame cools the joint down. Okay.
Nice.
Thanks. All right.
Yeah, HA plus you have to build up a little bit, hyaluronic acid.
Yeah. So I know we're
that
coming
it?
close to the end. We need to kind of wrap up tonight, but if you have a couple more questions, we'll run around prizes to everybody. Again, we want to thank you for coming. Everybody has the opportunity to win prizes. You all get 15% off our entire line this week. The other thing I want to point out to you is our CEO and founder's birthday happens to be tomorrow.
24th.
And if you hadn't noticed, there are some additional opportunities to purchase online his favorite products. They are birthday bundles, and they are actually 20% off. So although you get 15% off the entire line, if you happen to purchase the bundles, those are already marked at 20% off, and those are some of his favorites and some of our favorites. So I heard you say you were trying, Doctor, I think you were trying Thermogenesis. Its companion product is Nutriglutide. So Thermogenesis is that fat burner that doesn't
Can't say that.
Whatever, Trace.
It's physiologically impossible. Can't burn fat.
Okay, it enhances the metabolism, right? It doesn't give you the fetcher thing going on,
Good.
like you're not. Yeah, okay,
Beautiful.
so
It's perfectly
there's no
said.
stimulant in it. Okay, so the other side is what we call Nutriglutide, and that really helps, with insulin resistance, cortisol resistance. If someone's trying to get rid of belly fat in particular, Nutriglutide is a great option. So if you want to try and switch up, that might be something to try. Okay, and Nutriglutide and Thermogenesis, I believe, are on
You
the
can
birthday
even
bundles.
stack that with glucose.
Yeah, there you go.
3 Thermogenesis in the morning.
All right.
1 Nutriglutide with each meal.
Hey
1
guys, if
Glucolyze
any of
with
y'all
each
need
meal.
my phone number still, my card is
1
at the
Glucolyze with each
table
meal.
on the way out. I am your local rep for Georgia. A lot of y'all are new faces, and some of y'all came all the way from Tennessee. Y'all came a long way. And this group here is just moved from Hawaii, and their practice is in Texas, but they live in Georgia.
My
So
goodness.
we've got people from all over here. It's really
so you
cool.
can never find them.
Can
Good luck.
never find them. Maybe not.
Like,
we
we're over
have-
here
We
now.
actually started here.
They kept switching tables. I was like, sit down.
We have more fact sheets at the back. If there's anything, you just want to peruse those folders. We didn't have enough of the stands to show you, but if there's anything she talked about on your way out, look at those folders. Grab some text sheets if you want to know, okay? And if you need any help ordering, we'd like for you to order online, but you can also ask me for help, okay? I'm happy to put in the orders for you anytime, all the time. Also, if you didn't know, some of y'all that are new, I am a registered dietitian. I've been a dietitian for 25 years. I am here to help you and your patients. If you have a patient that you need a little bit of hand-holding, I drive a lot. So just say, hey, Rhonda, I need your support with this patient. Can she call you? Can he call you? Sure. I'm behind the windshield all the time. Y'all know that. Most of y'all know that, but some of y'all don't. So I wanted to be sure y'all knew that I'd offer to help some patients, those tough patients that need a little bit more hand-holding. So I just moved up to the North Georgia mountains, but I am always here in Atlanta. That's where most of the work is. So I'm everywhere. I'm all over Georgia, but mostly here in Metro Atlanta and South. Lots of people finally. I just moved from Peachtree City, so I had a lot of healthcare providers that I knew in my area. I lived there for 15 years, but now I moved up to the mountains. So, and I really appreciate all y'all coming and getting to know each other. And I wish normally we had more time to get to know each other, but hang out. We're not leaving.